Hi everyone, my name is Rick Alfera, and on behalf of my group, I would like to welcome you to our presentation on pediatric health advocacy and community resource promotion. Before we begin, I would like to give a special thanks to our community and academic preceptors for all their support and guidance throughout this project. I would now like to introduce our primary community partner, St. Christopher's Hospital for Children and their Center for the Urban Child. The CUC is located in North Philadelphia and provides comprehensive care and treatment for thousands of children in the greater Philadelphia community. The CUC was developed to provide personalized care catered to children living in the area. Recognizing that good health goes beyond the clinic, the center focuses on the integration of preventative care, parenting advice, legal assistance, social support, and community resources into pediatric primary care. The team believes in a holistic approach to the care of the child by supporting the health and well-being of the entire family. We also work to promote the Children's Advocacy Project, which is an invention of Dr. Daniel Taylor, interim medical director of the CUC. The Child Advocacy Project soon became the CAP4Kids website, which serves as a repository of community resources in Philadelphia for children and their families. The website provides printable parent handouts to guide parents about all things healthcare related and beyond. The website has the contact information for over 500 organizations in Philadelphia, as well as the option to sign up for a mailing list to stay up to date with all the resources. Feel free to check out our website here, and I'd now like to introduce our next speaker, Sola, to discuss our projects a bit more in depth.
Thanks, Rick. Our project this summer was twofold. The first part of our project, we created an instructional video for the CAP4Kids website homepage with an English voiceover and Spanish and English subtitles. We also developed an Instagram account to share the hints of the week, which are healthcare-related tips provided by Dr. Taylor associated with the CAP4Kids mailing list. Lastly, we confirmed over 500 resources for activity, communication channels, and filtered them for zip code search capabilities. Our second project focused on revisiting and refining the Pediatric Navigator program at the CUC. The Navigator program was established with the goal of addressing social needs and providing corresponding resources. For this part of our project, we researched, reviewed, and created a presentation on the social determinants of health to outline the roles for navigators within the CUC and their role within the community. We also created a navigator workflow guide that outlined the responsibilities of a navigator, as well as provided examples of how to deliver screeners and interact with patients. We created a navigator calling card to promote efficient communication between physicians and navigators that lists what services have been provided by the navigator and what other services that they can provide. We also developed a navigator resource sheet. This provided succinct summaries so that navigators can feel empowered when educating and providing families with these resources. And lastly, we made handouts for each research category, including QR codes. And the codes linked to the appropriate pages on CAP4Kids using their smartphones and has great potential to streamline resource counseling and reduce the amount of papers that patients must take with them.
We would like to share a few of the results from the projects we worked on this summer. First is a piece of the presentation created to assist navigators in using screeners with considerations of the social determinants of health. We also provided a link to the instructional video that will be posted on the homepage of the CAP4Kids site. There is also a link to the new Instagram page. Feel free to follow us at CAP4Kids_Philly and share this profile with your colleagues, friends and family, or clients. Lastly are two examples of the resource sheets created containing QR codes for convenient access to the site.
For our reflection, we decided to focus on the most impactful indicators of health, or known as social determinants of health. We wanted to start with some background we kept in mind. Some of the most important parts that we kept in mind while completing our projects for the community are economic stability, education, social and community context, health and health care, which also includes health literacy, and neighborhood and built environment. Specifically, health literacy is described as the degree individuals have to obtain, process, and understand basic health information and services so that they may make appropriate health decisions. This idea was especially important when working on certain projects, as the focus was to make the information we compiled into something accessible to many families in the greater Philadelphia community. Focusing on our summer, we created at least 6 different projects centering around social determinants of health. The PowerPoint for social determinants of health we created was tailored towards the incoming pediatric navigators and healthcare workers at St. Christopher's. The Excel file we created included the resources on the CAP4Kids site, as well as resources that can be searched by zip codes in the Philadelphia area. Sheets with QR codes were made so that families in the doctor's office at St. Chris can scan the laminated sheets to be taken to the Cap for Kids site for easier access and clarity. 2 projects were centered around Cap for Kids specifically. First, an introductory video was made to help parents navigate the website along with subtitles in Spanish. Finally, an Instagram page was created to reach a larger target population for physicians, healthcare workers, and families. We thank you for your time in listening to our Summer Bridging the Gaps experience. We hope you enjoyed it.